Which of the following is a major effect of angiotensin-2? A. Stimulation of thirst and vasopressin secretion. B. Vasodilation. C. Inhibition of aldosterone secretion. D. Tachycardia. The answer is letter A. Angiotensin-2 stimulates the thirst center in the hypothalamus and increases vasopressin or antidiuretic hormone secretion from the posterior pituitary gland. Angiotensin-2 does not cause vasodilation but is a potent vasoconstrictor. Angiotensin-2 increases but not decreases aldosterone secretion. It could cause bradycardia but not tachycardia, which is attributable to baroreceptor reflex in response to hypertension. Number 2. In neutrophils, monocytes, macrophages, mast cells, and keratinocytes, a class of eicosanoids is synthesized by 5-lipoxygenase. A. Thromboxanes. B. Arachidonic acid. C. Prostaglandins. D. Leukotrienes. The answer is letter D. Leukotrienes are synthesized by the 5-lipoxygenase in neutrophils, monocytes, macrophages, mast cells, and keratinocytes. Number 3. What do you call a response whereas there is redness, flare, wheal, and pain or itching in an intradermal administration of histamine? A. Triple response. B. Gastric acid secretion. C. Swelling response. D. Anaphylactic response. The answer is letter A. Intradermal injection of histamine produces a triple response of Lewis, whereas it is similar to insect and plant sting, creating redness, flare, wheal, and pain or itching. Number 4. Blank is the common mold that are found in rye seeds, oats, wheat, and barley. It is a serotonin agonist in nature. A. Acrinonium sinophyalum. B. Neotyphodium sinophyalum. C. Claviceps purpurea. D. Bacillus anthracis. The answer is letter C. Claviceps purpurea is the common mold that attacks the seed of rye, oats, wheat, and barley. Number 5. An enzyme that is a decapeptide from canins in which it dilates the blood vessels. A. Bradykinin. B. Kallikreins. C. ACE inhibitors. D. Calidin. The answer is letter D. The kinins, bradykinin and calidin, are polypeptides that dilate blood vessels. Two distinct enzymes, one from plasma and the other from tissue called kallikreins, catalyze the formation of two polypeptides, bradykinin, a nonapeptide, and calidin, a lysobradykinin and a decapeptide. Number 6. Blank is a potent vasodilator that lowers blood pressure and total vascular resistance. A. Eicosanoids. B. Bradykinins. C. Leukotrienes. D. Platelet activating factor. The answer is letter D. Platelet activating factor is a potent vasodilator and it lowers blood pressure and total vascular resistance. Number 7. Blank is released from membrane phospholipids primarily by phospholipase A2 in response to physical, chemical, hormonal, and neurotransmitter stimuli. A. Prostaglandins. B. Arachidonic acid. C. Thromboxanes. D. Leukotrienes. The answer is letter B. Arachidonic acid is released from the membrane phospholipids primarily by phospholipase A2 in response to physical, chemical, hormonal, and neurotransmitter stimuli. Number 8. Which among the following are not one of the primary tissue sites in storing histamine? A. Lungs. B. Basophils. C. Myenteric plexus. D. Skin. The answer is letter C. The primary tissue sites storing histamine are the lungs, skin, mucosa layer of the stomach, and basophils. Number 9. What receptor accepts histamine, causing an increase of gastric acid and pepsin secretion in the gastric mucosa? A. H4, B. H2, C. H1, D. H3. The answer is letter B. Histamine can stimulate glandular tissues to increase secretion, and it has the ability to increase gastric acid and pepsin secretion from the gastric mucosa via H2 receptors. Number 10. The Greek word akosi means blank from the stem word for akoisanoids. A. 22, B. 25, C. 40, D. 20. The answer is letter D. The Greek word akosi, meaning 20, serves as a stem word for akoisanoids. Number 11. It is an aftermath of a certain decrease in peripheral resistance of the cardiovascular system done by histamine. A. Gastric acid production. B. Vasodilation. C. Hypotension. And D. Venodilation. The answer is C. Histamine in the cardiovascular system dilates arterioles, capillaries, increases cardiac contractility and heart rate by activating both H1 and H2 receptors, and there is a decrease in peripheral resistance resulting in hypotension. Number 12. What is being stimulated when a certain event happens after the vascular smooth muscle relaxes as H2 receptors are coupled to GS protein adenyl cyclase? A. Gastric acid secretion. B. Gastric acid production. C. Vasodilation of small arterioles. D. Vasoconstriction. The answer is A. Stimulation of GS-coupled H2 receptors activate adenyl cyclase and increase tissue CAMP levels. The vascular smooth muscle relaxes and gastric acid secretion is stimulated. Number 13. A major factor that is released from the gastric mucosa and it stimulates acid production by acetylcholine and gastrin. A. IgE molecule. B. Prostaglandin D2. C. Histamine. D. Thromboxane. The answer is letter C. Histamine release is a major factor in the stimulation of acid production by both acetylcholine and gastrin. Number 14. These are first-generation H1 antihistamine drugs that are unionized at physiological pH and cross the blood-brain barrier except A. Cetirizine, B. Cyproheptadine, C. Meclizine, and D. Diphenhydramine. The answer is A. Most frequently used first-generation H1 antihistamines are diphenhydramine, dimenhydrinate, hydroxyxylene, chlorpheniramine, meclizine, and promethazine, and cyproheptadine. These drugs are unionized drugs at physiological pH and easily cross the blood-brain barrier. Number 15. These are commonly used second-generation drugs under H1 antihistamines which are ionized at physiological pH and is difficult to cross the blood-brain barrier except A. Loratadine, B. Diphenhydramine, C. Fexofenadine, D. Cetirizine. The answer is B. Classification of H1 antihistamines that are commonly used second-generation drugs are loratadine or claritine, cetirizine or Zartec, and fexofenadine or Allegra. This class of drugs is ionized at physiological pH and is difficult to cross the blood-brain barrier. Number 16. Which of the following is a function of angiotensin-converting enzyme or ACE? A. Converts angiotensinogen to angiotensin 1. B. Converts bradykinin to inactive metabolites. C. Directly promotes aldosterone secretion. D. Converts angiotensin 2 into angiotensin 3. The answer is B. ACE converts bradykinin to biologically inactive products. This is the reason that the feline patients on an ACE inhibitor may have bronchoconstriction as a side effect. ACE converts angiotensin 1 to angiotensin 2 but does not affect the conversion of other angiotensin-related proteins, nor does ACE directly affect aldosterone secretion. Number 17. Which of the following is the most frequently associated side effect of H1 antihistamines? A. Antiandrogenic activity in males. B. Sedation. C. Inhibition. The answer is B. Most of the older, first-generation H1 antihistamines possess some sedative properties. The newer, second-generation H1 antihistamines tend to have minimal or no sedative properties. Cimetidine, an H2 antihistamine, is a potent inhibitor of cytochrome P450 enzyme, which also inhibits testosterone synthesis. Many H1 antihistamines have antimuscarinic properties, which will decrease gastrointestinal motility, and they cause constipation occasionally. Number 18. How does diphenhydramine work to relieve the symptoms of hypersensitivity? A. It competitively antagonizes the effect of histamine at H1 receptors. B. It stabilizes mast cell to inhibit histamine release. C. It inhibits the binding of allergens to IgE. D. It promotes the endocytosis of H1 receptors. And E. It promotes the shift of active H1 receptors to the inactive state. The answer is E. In the past, the general concept was that H1 antihistamines competitively antagonized H1 receptors. However, recent evidences indicate that H1 antihistamines shift the active H1 receptors to the inactive state. These drugs do not stabilize mast cells to inhibit histamine release, nor do they evoke H1 receptors to endocytosis. Number 19. Which of the following statement is incorrectly associated with prostacyclin? A. Prostacyclin is a vasoconstrictor. B. Prostacyclin is formed from platelet endoperoxides. C. Prostacyclin inhibits platelet aggregation. D. Prostacyclin is spontaneously hydrolyzed into inactive 6-keto prostaglandin F1 alpha. The answer is A. Prostacyclin is a vasodilator but not a vasoconstrictor. Prostacyclin receptors are coupled to GS, thereby increasing CAM synthesis and leading to relaxation of vascular smooth muscle and a decrease in platelet aggregation. Prostacyclin is synthesized in the endothelial cells utilizing platelet endoperoxides, which can be inhibited by NSAIDs, aspirin in particular. Number 20. Which of the following statement regarding histamine, H2 antihistamine, is correct? A. Nizatidine may cause drug interaction because of its inhibition of the cytochrome P450 enzyme system. B. Ranitidine is more potent than cimetidine. C. Ranitidine is a potent central nervous system depressant. And D. Famotidine has a plasma half-life much longer than that of the cimetidine. The answer is B. Ranitidine is more potent than cimetidine as an H2 antihistamine. Cimetidine but not nizatidine may cause drug interaction because of its inhibition of the cytochrome P450 system. Ranitidine at a very high dose may cause central nervous system disturbances including depression. Famotidine, cimetidine, ranitidine, and nizatidine have similar plasma half-life of 2 to 3 hours. Number 21. Which of the drugs listed below inhibits the release of histamine? A. Betazole. B. Cimetidine. C. Dimenhydrinate. D. Cromolyn sodium. The answer is D. Cromolyn sodium inhibits histamine release. This is due to cell membrane hyperpolarization induced by opening of chloride channels. Dimenhydrinate, betazole, and cimetidine are H1 antihistamines, H2 agonists, and H2 antihistamine respectively. Number 22. Which of the following statement regarding serotonergic receptor is incorrect? A. All serotonergic receptors are G protein-coupled receptors except serotonin 3 receptor. B. There are more classes of serotonergic receptor than any other receptor of biogenic amines. C. Stimulation of serotonin 1 receptor increases gastrointestinal motility. D. Stimulation of serotonin 2 receptor evokes severe vasoconstriction, which accounts for fescue grass toxicity. The answer is C. Stimulation of serotonin 4 receptor by agonists such as cisapride but not stimulation of serotonin 1 receptor increases gastrointestinal motility because serotonin 4 receptors are coupled to GS, which result in an increase in CAMP synthesis and acetylcholine release from the vagus nerve. Number 23. Which of the following statement is incorrect? A. Arachidonic acid is the precursor for the synthesis of the leukotrienes. B. Aspirin inhibits the formation of prostaglandin F2 alpha. C. prostaglandin E2 increases body temperature. D. Leukotrienes are potent relaxants of bronchial smooth muscle. The answer is D. Leukotrienes are potent stimulators of the contraction of bronchial smooth muscle. The other statements are all true. Number 24. Which of the following Autacoid inhibitor or antagonist is a leukotriene receptor antagonist that blocks leukotriene-induced bronchoconstriction? A. Cetirizine. B. Lisinopril. C. Montelukast. D. Xyloton. The answer is C. Montelukast is a leukotriene receptor antagonist that blocks leukotriene-induced bronchoconstriction because asthma in cats may be attributable to increased autocoid release including histamine and leukotrienes. Leukotriene receptor agonists can be used as adjunctive therapy. Cetirizine is a second-generation H1 antihistamine. Lisinopril is an ACE inhibitor. Xyloton is a 5-lipoxygenase inhibitor which inhibits leukotriene synthesis. Number 25. Why doesn't fexofenadine cause sedation? A. It is a drug that blocks H2 receptors in the central nervous system. B. It is not effective blocking cerebral H1 receptors. C. It is an excellent substrate for P-glycoprotein, which pumps drugs including fexofenadine out of the central nervous system efficiently. D. It is ionized at pH 7.4 and does not cross the blood-brain barrier. The answer is D. The second-generation H1 antihistamines, including fexofenadine, are ionized at physiological pH 7.4, and the ionized form of the drug does not cross the blood-brain barrier to cause sedation. Fexofenadine can block cerebral H1 receptors in vitro, but it cannot reach the target site in the CNS in vivo. P-glycoprotein is not the reason that fexofenadine does not cause sedation. Number 26. Blank is an analog of histamine, which is an H2 receptor agonist. A. Pentagastrine. B. Betazole. C. Meclizine. D. Diphenhydramine. The answer is B. Betazole is an analog of histamine, which is an H2 receptor agonist. Number 27. Blank is a prostaglandin E1 analog that is a protective agent for the gastrointestinal tract and directly inhibits gastric acid secretion by parietal cells. A. Montelukast. B. Cloprostenol. C. Dinoprost. D. Misoprostol. The answer is D. Misoprostol is a prostaglandin E1 analog that has two functions which makes it useful protective agent of the gastrointestinal tract, and it directly inhibits gastric acid secretion by parietal cells. Number 28. These are the drugs that are leukotriene receptor agonists that are effective for treating asthma in small animals. A. Cimetidine. B. Misoprostol. C. Cetirizine. D. Zafirlocast. The answer is D. The leukotriene receptor agonists are emerging as effective treatment for asthma symptoms. Montelukast and Zafirlocast are now used in small animals. These drugs reduce bronchial spasm and improve pulmonary function. Number 29. These are the drugs that are leukotriene receptor agonists that are effective for treating asthma in small animals. A. Cimetidine. B. Lisinopril. C. Montelukast. D. Xyloton. The answer is C. The leukotriene receptor agonists are emerging as effective treatment for asthma symptoms. Montelukast and zafirlukast are now used in small animals. These drugs reduce bronchospasm and improve pulmonary function. Number 30. Blank is the luteolytic hormone produced by the ovaries and endometrium. A. Prostaglandin F2 alpha. B. Prostaglandin E1. C. Prostaglandin E2, and D. Prostaglandin EP3 receptor. The answer is A. Prostaglandin F2 alpha is the luteolytic hormone produced by the ovaries and endometrium. Number 31. An enzyme that inactivates both bradykinin and kallidin. A. Angiotensin. B. Bradykinin. C. Kallikrein. D. Proteases. The answer is D. Proteases inactivate both bradykinin and kallidin. Number 32. Drugs such as blank inhibit activation of beta-1 receptor. A. Misoprostol. B. Levimazole. C. Propanolol. D. Candesartan. The answer is C. Drugs such as propanolol inhibit activation of B1 receptors. Number 33. A distinct enzyme of kinins that is derived from tissues and is a decapeptide. A. Bradykinin. B. Kallikrein. C. Kallidin. D. Angiotensin. The answer is C. Kallidin is a distinct enzyme of kinins that is derived from plasma and is a decapeptide. Number 34. Blank is a potent chemotactic chemical for leukocytes, eosinophils, and monocytes. A. Leukotriene B1. B. Leukotriene B2. C. Leukotriene B3. D. Leukotriene B4. The answer is D. Leukotriene B4 is a potent chemotactic chemical for leukocytes, eosinophils, and monocytes. Number 35. Blank are the primary cells that store histamine where it exists in a complex with heparin sulfate and chondroitin sulfate E in a storage granules. A. White blood cells. B. Mast cells. C. Parencial cells. D. Platelets. The answer is B. Mast cells are the primary cells that store histamine where it exists in a complex with heparin sulfate and chondroitin sulfate E in storage granules. Number 36. Blank is the major peptidase in kinins. A. ACE. B. Alpha-2 globulins. C. B1 receptor. D. B2 receptor. The answer is A. ACE is the major peptidase in kinins. Number 37. Blank is a synthetic prostaglandin F2 alpha analog. A. Dinapros. B. Misoprostol. C. Levimazole, D. Cloprostenol. The answer is D. Cloprostenol is a synthetic prostaglandin F2 alpha analog. Number 38. Blank inhibits the release of histamine and other autocoids from mast cells. It does not inhibit H1 and H2 receptors, but opens chloride channel to hyperpolarize the cells. A. Acetylcholine, B. Sodium bicarbonate, C. Cromolyn sodium, D. Prostaglandin. The answer is C. Cromolyn sodium inhibits the release of histamine and other autocoids from mast cells. It does not inhibit H1 and H2 receptors but opens chloride channels to hyperpolarize the cells. Number 39. Blank receptors may play a role in early events of inflammation, edema, and thermal hyperaglasia. A. H1, B. H2, C. H3, D. H4. The answer is D. H4 receptors may play a role in early events of inflammation, edema, and thermal hyperaglasia. Number 40. Blank is present in high concentration in platelets, the endochromaffin cells, and myenteric plexus of the gastrointestinal tract and the central nervous system. A. Prostaglandin, B. Mast cells, C. Leukotriene, and D. Serotonin. The answer is D. Serotonin is present in high concentration in platelets, the enterochromaffin cells, and myenteric plexus of the GI tract and the CNS. Number 41. These are the drugs which are inhibitors of gastric acid secretion. A. H1 antihistamines, B. H2 antihistamines, C. H1 histamines, D. H2 histamines. The answer is B. H2 antihistamine drugs are inhibitors of gastric acid secretion. Number 42. It is a potent promoter of platelet aggregation. A. Platelet activating factor, B. Leukotriene, C. Histamine, D. Renin. The answer is A. Platelet activating factor is a potent promoter of platelet aggregation. Number 43. Which type of histamine receptor inhibit neurotransmitter release? A. H4, B. H3, C. H2, D. H1. The answer is B. H3 receptors are located presynaptically on neurons and inhibit neurotransmitter release. Number 44. How many percent eye drop containing cromolyn sodium is used to control allergic conjunctivitis? A. 4%, B. 9%, C. 5%, D. 11%. The answer is A. The 4% of cromolyn sodium eye drop is used to control allergic conjunctivitis. Number 45. Blank is an alpha-2 globulin synthesized in the liver and is present in the circulation. It is the precursor for all angiotensins. A. ACE. B. Aldosterone. C. Angiotensinogen. D. Renin. The answer is C. Angiotensinogen is an alpha-2 globulin synthesized in the liver and is present in the circulation. It is the precursor for all angiotensins. Number 46. All of these are H2 antihistamines and are inverse agonists except A. Misoprostol. B. Famotidine. C. Ranitidine. D. Nisatidine. The answer is A. H2 antihistamines include cimetidine, ranitidine, famotidine, and nisatidine. Recent evidences suggest just like H1 antihistamines, these drugs are inverse agonists. Number 47. Other leukotrienes do not possess this action. It promotes adhesion of neutrophils to the vascular endothelium and their transendothelial migration. A. Leukotriene B2. B. Leukotriene B4. C. Leukotriene B1. D. Leukotriene B3. The answer is B. Leukotriene B4 is a chemotactic chemical in that of the leukotriene. Other leukotrienes do not possess this action. It promotes adhesion of neutrophils to the vascular endothelium and their transendothelial migration. Number 48. Histamine acts as a blank in the central nervous system. A. Neurotransmitter. B. Camp synthesis. C. Beta blocker. D. Anaphylaxis. The answer is A. Histamine acts as a neurotransmitter in the central nervous system. Number 49. Propranolol inhibit activation of B1 receptors and thereby reduce blank. A. Angiotensin-2 increase. B. Renin production. C. Angiotensin-2 decrease. D. Renin release. The answer is D. Propranolol inhibit activation of B1 receptors and thereby reduce renin release. Number 50. A distinct enzyme of kinins that is derived from plasma and is a nonapeptide. A. Bradykinin. B. Kallikrein. C. Kallidin. D. Angiotensin. The answer is A. Bradykinin is a distinct enzyme of kinins that is derived from plasma and is a nonapeptide.